pledge, please? Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Everybody have a chance to review the minutes?
I'll make a motion.
A motion to accept? Second. Any discussion? All in favor by saying aye?
Aye.
Opposed? Okay, so we'll move on to resolution number 1. 18-1. Resolution authorizing budget modification. Jim Chang, you want to cover that?
Yeah, the first is a resolution and, because we budgeted, not enough and additional hours and overtime needed for, increased preventive efforts.
I'll move it for discussion.
Second. Thank you. Any discussion?
You're just moving money around. Right?
Move
Yeah.
money around. End of the year.
It's okay with
I
me.
think I have a question.
Yeah, go ahead.
This, I guess, for Bill or Steve. Last year's budget towards the end, we cut across the board. We did like a percentage of cut to additional hours. Is there a way to do it? Kind of, I just wonder where we ended up. Like, so is this the first time that you come back this year?
I believe it is.
Right, I'm just saying, so we did the cut across the board for many departments, overtime, additional hours and vacation buyback maybe?
Well, then we moved into a single line.
Right, okay. I guess I'll take it up after. I'm just trying to figure
You want
out.
a report that shows
So
budget
this,
versus actual?
right, so last year we went across the board in departments and cut different ones at budget time frame. Now, I know Department of Social Services has been back a few times, and she reported right away. We moved into that. So I just wanted to see how it shook out with other departments.
We could do that year to date, but we'll full impact until,
Yeah.
unfortunately, January.
Okay, I'll catch up.
Familiar. Any other discussion? All in favor?
All right.
Opposed? 18-2, resolution authorizing budget modification, increased early intervention EI program service funds.
Yeah, this request is because, this year we have more, about 20% increase of cases for early intervention. And this is out of our expectation. That's why we need to move some money. Modify the budget.
Second?
I'll second.
Okay. Any discussion?
Just a question, it seems to be working, right? I mean, these children
Oh, yeah,
are improving or
early,
safer than what they were.
early intervention is always better.
Yeah.
Yes.
Thank you.
Anything else?
Oh, thank you, sir.
All in favor?
Aye.
Opposed? Motion carries. 18-3, resolution authorizing budgetary modification, Health Department, preventative biological expenses.
This modification is because we have hepatitis A clusters in the county, and since it started middle of July, and we did a lot of vaccine and immunoglobulin. This money mostly will purchase immunoglobulin because some close contact, if they are less than 10 days and still in the window, in addition to vaccine, the CDC recommended to give immunoglobulin. That's what this costs for.
I'll move it.
Hepatitis.
Hepatitis A.
I'll second it.
Second. Any discussion? All in favor?
Aye.
Opposed? Motion carries. 18-4, resolution accepting overdose status or action UTADA grant from New York State Department of Health Research, Inc.
Okay, may I introduce Vera, and this project is her baby, and let her
So
introduce
the
it.
overdose, the action plan is a 3-year grant that focuses on changing the culture around our overdose epidemic that we're facing, along with the rest of the nation. We're not exempt from this epidemic. The grant is over a 3-year period where we'll receive $216,000. Most of that, I'll have Jen go over what our budget actually will look like for that. Most of it is staff timing, the time staff puts into the projects that we're putting together. A lot of the funds will be going to establishing linkages to care for pregnant women who use drugs. This summer, we did have 2 women that passed away from drug overdose that had children, and we know there is a problem. So we are looking to improve how we identify opioid use disorder within this population. We plan on working with our OB/GYN locally to see what their policies and procedures are and their readiness to work to help us and assist us to identify and treat these women. Also, pain control is obviously an issue if you have a patient that is has substance abuse disorder. They come into labor. How do you medicate these women? There's a lot of research out there, and we want to be able to help these physicians and do a better job. Chin Chang, did you want to include that?
No, you introduce everything, yes.
Okay.
This money is for prevention and for harm reduction, not for treatment. So we use this money, as Vera said, to compensate our staff salary.
Right. And helping providers based on evidence-based practice so they can do better treatment for their patients. Research has shown that if you are receiving treatment outside of the farm and the cocoa and actually with your primary care physician, you're more likely to stay on the treatment. So that's a beautiful thing. It's a population of substance use disorder community members that we can actually touch and make a difference. I think it's really important. It's a really cool grant. We're thankful that we're able to do this and actually put time in. So any questions, please ask. We have a whole bunch of stuff we want to do with this money. So it's pretty exciting stuff.
Okay, so let's get a motion for discussion.
Oh,
I'll
shoot.
make a motion for discussion.
Motion, second.
I always do that wrong.
Yeah.
I'm so sorry.
You know, when you walk in the room at budget time and you say, oh, by the way, we got $216,000, we'll give you a little grace.
You're gonna let me accept it? And, yeah,
I do have a kind of a comment,
please.
because you've been working, trying to do what's been going on for a while, right? And it hasn't been working right out there in the,
We really haven't paid much attention to it, to be honest with you.
so, because if whatever's out there is not working for some people anyway.
Yeah.
So, and you're going to try to do something a little bit different? but
We're
you-
trying to implement a whole program because we didn't have anything before. We knew there was something going on, but now we're looking at the data, and out of 16 other counties that are receiving this money,
Mhm.
we're like the next on the list. Our numbers, I mean, we need help. So I think this is gonna be able to provide us with the staff and the training we need to get out there in the community and actually make a difference.
Because each time I've been going to NISAC, I have not heard that some county can jump up and say, yeah, we're on top of it.
Yeah.
It seems like all the counties that I've been talking to are still in a mess.
We
And
are.
we are one of the biggest messes there is in the state.
We're ranked 16 or 17, yes, on that list.
Yes, we're right down at the bottom. And especially with overdoses, suicide.
Yes,
We are number one in suicide.
yes, and we got much better at how we're tracking the suicides compared to the overdoses, and if it was an accidental overdose, or did they code it as a suicide within our, emergency room departments. So we're getting better at that too, but the data is all over the place. That's the honest answer. I do have some data. We are doing better in some areas where we're getting more physicians signed on to be able to prescribe Suboxone and Subutex to patients with the overdose with substance abuse disorder, which is a beautiful thing. We need more providers to be able to do that, get these people on treatment. They need to get on treatment. We also would like to see more harm reduction, things being put into place that's coming. We are looking at a whole bunch of different options. Which,
Not good out there.
no,
Well, you gotta start somewhere, and I'm glad current sheriff has taken a program that's focused on even getting a preventative program. And I would just throw a suggestion that Phil's not there, that you collaborate even with it, because of that he's worked to get the new, even though it looks bad in front of the paper, the HIDA designation is important as well, because it comes along with a lot of other funding and bodies and people that work even with your drug task force. But outside of that, to finally put a program in the jail for the, what we call the revolving door people, right? So they get out. I mean, the attitude before was, we'll see you in a little while, we'll see you shortly. Now it's to get in there and, is it Farnham?
Yeah.
Farnham.
Farnham.
There was programs and available grant funding to get in the sheriff's department with certain things like blockers. So I just suggest you kind of have that conversation, because
absolutely.
those things could run in parallel, I think.
They
because
could,
those
and
are the
I would-
frequent return people who
Yes.
are going in and they're getting out and it's happened again.
And
they're
then,
going back.
or they overdose because
Yeah.
they've been without the
Yep.
drug for
But-
72 hours and think they can use the higher dose.
I just
It's
wanna
very
We
scary.
haven't taken advantage of the opportunity when they're out of the situation, they're in jail, there's programs and things that could happen, but who's Farnham again? I can't remember his name right now.
Eric.
Eric,
Yeah,
great.
I mean, he just great conversations. I would suggest
Yes.
just collaborating with them,
Yes.
because they know who the return customers are.
And the beauty of this is that, well, it's really not beautiful because it is hepatitis A, but we are in the jail, inoculating not only the inmates, but the personnel that work there. We're in Farnham and, setting up immunization clinics so we can, we started a relationship. That's the beauty of it. Now, let's grow it.
Mhm.
Because we're already starting to touch this population. Now's the time. And this money couldn't come at a better time, because now we can do it.
Just to say, I mean, Margaret, I know you say we're at the bottom of the barrel. We sat here how many years ago and we were at the bottom of the health rankings
Yes.
too. But there's a lot of those programs that have come into play and we've climbed out of it. So you gotta start somewhere. I'm glad you got the grant.
We're gonna keep going too.
Yes, we are.
I got a lot of good things going on.
$72,000 a year for 3 years.
For how many years now?
3 years.
3 years.
Yeah.
Oh, yeah.
And I look forward that this will continue after 3
Mhm.
years.
Still stepping out of the room because I'm trying to figure out where to put it in the budget now.
Just one question, if you've been talking to outside ones and other counties.
Yes.
And, let's say I was a druggie and I got onto the program and I'm doing really good. Now, would you have me as a, let's say, cleaned up person, work with your program to go to see this man over here because he's really in deep doo-doo, and I can say to him, well, this is what I did, this is how you helped me. So you're going to be able to use some of the people that are already on their way to the right way to be able to help you.
It's already
Yeah.
peer education.
Yeah.
Both Cocoa and
And Farnham.
Farnham, they have this program.
Yes.
And they use, as you said, past drug user and their own experience
Because
p-
he's
help
gonna
other
believe,
people.
he's gonna believe me quicker
Yeah.
than he's gonna believe
Right.
you, because I've been laying around on the floor.
You're not
rolling
kidding.
around and doing all
Yeah.
that.
So it's,
The bad
this
thing.
already happened.
So that's,
It's
Mhm.
already happened.
Yeah,
Yes.
there's people in that are actually seeking hours. They have to do 500 hours community and work with the program before they're qualified
Yeah.
to be a one-on-one peer.
Mhm.
Because they've contacted Arise a
Well,
few
If,
times trying to
if
get
I
some
can
hours.
clean up, then maybe somebody else can, then
That's
he can do
Yeah.
her.
But it's
Yeah,
already,
you do
it's
that.
already there, it's
Yeah.
fairly new, but it is growing, so.
I can't picture you rolling around on the floor.
I got to run around on the road. Or whatever I was doing.
Don't do that.
I just hope the press spells doo-doo.
So is there any other discussion?
Very good.
All in favor?
Aye.
Opposed? Congratulations.
Thank you so much, thank you.
Thank you.
Resolution HE 5, resolution in support of allocating unrestricted resources to local health departments to fortify provision of core public health services and prepare for implementation of expanded public health mandates. I have no idea what I just said.
Sounds
I
good,
was
huh?
going to say.
I'll move.
Second.
Yeah.
Let him explain it first.
Well, for discussion.
Discussion.
Okay, thank you.
Mhm.
This state give local so many unfunded or underfunded mandates, and this is the newest one. And this year started October 1st, yes, the state reduced the lead level from 15 to 5, and this is reasonable. Scientifically, yes, less lead and it's helped kids to develop. But what we do, state not to give us enough money, and really, yes, this nice HO encourage each county, yes, put a voice there and work together get state funding. So this is part of our efforts. The next resolution is related to it. I just make this not clear. So this is the background.
Any discussion?
Yeah, pass it.
Thank you, Margaret.
Yeah.
All in favor?
Aye.
Opposed?
She's going down the stretch here.
Yes. HE 6, resolution authorizing budget modification for the purchase of additional X-ray fluorescent paint analyzer, XRF.
This is a request to purchase this device. This device is for testing lead in the painting chips. And the cost is $17,000. And we thought we may have it, we don't have it, and we need it. And we put into the plan for next year, but this year in our budget, and Nelson calculated it and see we can use this year's money, so we can save some budget money for next year. That's why we come here.
So you're,
Where you getting the money from?
From our savings this year,
Oh.
this year's money.
Nelson, you want to explain?
Nelson?
Yeah. In the 2019 budget, we had money budgeted to purchase vehicles.
Yeah.
Then we ended up leasing them. So we had money that we moved out of the auto equipment line into auto rental, but we had money left over. That money's already been taxed for the residents, so I'm using some of that money that's left over in that account to move into, so we buy this XRF this year. There's $17,000 in the 2020 budget that I can take out if you approve this budget modification for this year.
otherwise that money would go back to the general fund, the savings from the,
Yeah.
Correct.
And then we'd have to purchase it on 2020 funds.
I'd rather pass it. I got a question.
We have a motion for discussion.
I'll make it.
Second.
Frank must have seconded it.
All right. Go ahead, Margaret.
Well, the question is, when are you going to be able to use it? Like, if I fix my house over, do I have to call you up so you can come up and see if there's lead? My house is 100 years old, so you know there's lead, almost as old as I am. There's lead in my house. with the paint. I mean, it's been painted 40, 50 years ago, and that's the way it was. Or is this only gonna be on public buildings? How are you going to, somebody gonna call you up and say,
I'm not environmental.
The way, the way we do is, because the state mandated testing kids level reduce, and we get to report. And when we get to report, and we will bring this device to any house
the house?
the child
Okay,
lives there, and yes, this will test it. It's not that use this test whatever house, and mostly focus on these kids. They live there.
okay.
Sure.
There will be a lot of it out there.
I understand it, but I just have, so there's leftover monies in auto in the 2019 budget
Yes, sir.
that you're utilizing to
Yes.
help pay for this thing.
Yes.
Okay.
Any other discussion?
I'm for that.
All in favor?
Aye.
Opposed? Number two, director's report.
Okay. My report, and I know we still have budget to discuss, and let me make it as fast as I can. Where is my?
Getting high tech real quick.
This time I want to change a little bit and talk. Usually I talk disease first, and then talking about the our program operation. And today I want to. No, not the new window. Okay, live with that. I don't want to. Really, our whole department operation is improved, and I reviewed. I reviewed. Oh, too small, right? Okay.
You want me to?
Here, I'll be.
A 52 window.
You have to look
Here,
at it.
right here.
Slideshow.
Right here,
Yeah,
okay.
slideshow.
Right there.
Okay, thank you. And I reviewed, and since I came here, this is my 7th year, and the first 3-4 years, we focus on long-term care, and a home health care program. And after that, and we focus on making the hospice out of red, and now hospice out of red for more than a year, and many credit should go to Vera, and really she leads the program and reduce drug cost dramatically. And so recent year, really, our finance and give credit to Jan and Nelson is really our operation change. And the bigger change is this two graph is not we made it. It's a company we contracted. They help us to do finance report to state health department made it. And you can see from 18 is here, it's revenue, and this is 17 revenue, and this is the expenditure. And you can see because of their work, and our grant increased the revenue, and mostly is they make this put this way, maximize state Article 6 funding and increased, and also our service increased this here, and the Medicaid service volume increased, so revenue increased, and our operation cost reduced, and sure, our expenditure in medical supply and the others increased a little bit. But this overall, it's a review, really, as a department with this finance, because so many times always talk about, oh, how's disease prevention, how's hospice. Very few cases I can have opportunity to give credit to our finance staff. So this is really very good. And talking about this, improve our operation, and as I reported to you previously, and last started probably a year ago, and we started do our strategic planning, and Vera and Diane leads the efforts, and we really, yes, we're going to finish it, and I thank you for all your current members' support, and we're very successful, and we set up um, our mission goals and our core values, and next April, we are going to do a community outreach, like a new branding efforts, and make a attract our community member to our building, and we will have a week-long session, and provide different seminar, different webinar, and or open house to promote our services in the community. So this is a bigger piece, and yeah, I want to take this opportunity to say thank you, and yes, when these events come out, and we will include you. And another this we're going still working with local and county government collaboration, and promote health, and this like a typical program, healthy highway, healthy healthy miles. This program is still going on very well, and here is another. Yes, this probably you already saw, and this program still going on, and we have this healthy miles, and this a group included OCO, Arise, and Great Bear Trails, and community members get together, and this selfie, and first day. OCO says they got like 800 hit,
Wow.
and forwarded
That's awesome.
hundreds times. And yes, it will be end at this month 17th, and so we will see how response, and this project really, they're not here still. I want to give some credit to community outreach and Jan's group, and they're very helpful to provide some information and work with us. So this really, it's a great service, and a great collaboration. Okay. Oh yeah, this is just some picture I put here, and yeah, well, we found some older picture. You know the lady? Okay. And we found this historical picture, and
Yes.
we're looking for money and approval to decorate our hallway, and this really
Put that up.
will help us boost our staff morale a lot.
That's,
I like
is that
that.
the new, is that the new rental fleet?
Oh yeah.
That'd be cool.
No wonder they got money.
That is,
So
I like that.
so this, yes, and under the few.
That should be.
Oh no. Okay. And let me go back, and another we're putting
Oh, yeah,
here.
I like that one too.
Yeah, and so we
The
choose
nurses.
about the 10, okay? And this is where going on. And
Do you know their names? Did anybody know who they are?
some we can recognize, some we cannot, but I think.
Yeah, that's the kind of stuff I do. I find out who they are. Genealogy, I'm big into that stuff. Yeah,
Okay.
that's cool. I like that.
And about our program department cooperation, this is another good example, and probably Vera can better interpret it to me, and this on the veteran, and
Yes, the We Honor Veterans program
Yeah.
through our hospice division,
yeah,
cool.
so yes.
where we go and visit the veterans with their permission, and we have a service member that is a volunteer. go to the home and usually present them with a certificate or a badge of honor
Oh, that's cool.
for his appreciation.
Yeah, and this is a Vietnamese War veteran, right? Yeah.
Oh, that's
And
nice.
this, yeah. And our hospice program, I just decided to verbatimly put it here and really community member, family member give us this wording, and I'm not going to read it really.
That's
Our
nice.
our hospice program doing a great job. Okay, let me quickly go to
Yeah.
without. Okay. Yeah.
It's there, we'll watch.
Okay, yeah, and about the disease and about the disease, hepatitis A is the biggest thing, and we have 50 cases since mid of July till now, and the most of cases is clustered in this certain specific population, and now the squeeze I feel is really state push us and say yes, you need to outreach to this population, and state feel we're doing not enough. Actually, we're doing a lot, and as already Vera mentioned previously, and our staff not just doing disease investigation for these 50 cases. And they identify close contact, give them vaccine, give them immunoglobulin. And also because this specific population and they involve in drugs, they involve in jail, and our staff had already set up a regular weekly clinic at the Farnham and at Cocoa. And we went to jail several times, not just to cover all inmates, because they stated consider all inmates in the same cell are close contact. So once we went there, like 26 or 27 people. And also we went to probation, and this population, and we went to Victoria House, and we went to DSS, work with DSS and identify DSS hotels, and it's a lot. We do our best to reach them, but the state still feel we are not reach enough. The difficult part that I realize is really state feel yes, it's easy for you, and you just go to this needle exchange site, and you can identify and quickly and find the people easily. No, actually it's not. We don't have needle exchange program. And this issue was discussed at the last week Board of Health meeting. And so this I just leave it here. And so overall, hepatitis A takes out a lot of resources. And at the last week Board of Health meeting, one member specifically asked what I feel our staff level, because yes, he was a very experienced, long time our member. My answer was yes, we have only one outbreak. Our staff put so many hours there, and we can handle. If second, any small things happen, our staff is already very thin and will be broken. We cannot handle. This is the situation. Okay. So this is hepatitis A, and other disease. Let me quickly briefly report to you. And the flu vaccine. And yes, we are in flu season, and our flu clinic this year doing very well. And usually every year we from the flu season usually started end of October to end of August to early September to next year April. And the whole season our program provide about 700, 800 doses of vaccine. But this year, till now, we already offer over 600 doses. And the more, we order more doses and,
Long ways to go.
yeah,
Long ways to
long
go.
way to go. And high dose flu vaccine is oh no, CDC not to say short. I cannot say short, but yes, we are out of stock, and will come by the end of this month. And one reason we saw increased flu vaccine need is really local. A lot of doctors refer their patient to us, especially high dose. They say, oh, we don't hold the high dose, go to county health department. So that's probably
Is that
a big
high
reason.
dose is more expensive?
High dose is more expensive. Yeah, high dose is more expensive. Yeah. And rabies situation. In the rabies situation, our environmental health doing great job. And this year, we have more positive wild animal positive for rabies. But our post-exposure number is lower than last year so far. And I hope, yes, we can keep it low, and hopefully we will keep it low. And this really save county money too, because some case, yes, we county need to pay the bill. So, and STD, I hope, yes. It looks like at good control, and we don't have syphilis case now, and gonorrhea and gonorrhea disease. If the case, I hope the number is lower than last year.
Good.
And Lyme disease probably will be higher than last year by the end of this year. And it's not a surprise, and just the most recently, someone told them, yes, 3 people hiking in the area, and 3 of them, each of them at least they found one tick. So this will be still continuous challenge. And these are my brief disease report, and also I prepared some additional about CBD briefly presented to you, and legislative tests that they want me to put here, and I put it here. And last month you requested trauma-informed care to be presented, and our manager Chantel, we originally yesterday, and she planned to come, but changed it to today. She's scheduled a state training for healthy family program, so she will come next month. By the way, TIC and the CDC just yesterday, first time sent out trauma-informed care announcement, and I will share with you when I go back to office. Oh, this is another picture, and our environment. Yeah.
I don't know how that got in there.
Okay. CBD, what is CBD? CBD, it's because of this cannabis and become very popular. And CBD is a component containing for medical marijuana use. And this naturally, it's in the plant called hemp. Hemp in the hemp. And this is hemp and marijuana is in the biologically in the same family. We can say they are cousins. But marijuana has something called THC. THC called psychoactive, but this CBD not cause the psychoactive, not cause harm. So this is what the CBD health benefits, and FDA already developed approved medicines. This is the first medicine FDA approved contains CBD for control these childhood epilepsy. So this, and some studies still going on other medical use for CBD. CBD now it's quite available, and a week ago I at Ollie's and walking the door, and they have signs there, so far something contains CBD. But the concern here is really FDA does not regulate it, and some consumer reporters, they reported that some products they purchased and tested, labels say, oh, it contains CBD, and tested no CBD at all. It's not so this is the a concern, and especially you talk about want me talk about the legal side, and this slide's talking about the legal side, and hemp, this plant used to controlled as controlled medicine, cannot plant. And last year, 2018, and the federal government has passed the law, and the hemp is not in the controlled substance. Instead, it's considered as an agricultural commodity, so promoted. And they say yes, the market will be increased, and especially you say in the state, yes, I located this wiki, and they listed Cornell University, Binghamton, and SUNY Morrisville. They have projects to study CBDs. So that's all I prepared my report. Any questions?
Just a comment on that. We had something on that about a year ago at NISAC. And when anybody wants to grow it here in New York State, which they are, even in the Oswego County, and soil has to be tested by the government, because there's certain things in the soil that you do not want in your hemp plant, or marijuana plant, whichever you're raising, which is not beneficial to the people. So there has to be a soil tested if you, as a farmer, chooses to raise that here in New York State. And right now, I think because of that passing it, a farmer out there now, if the soil passes, I take it they can now start planting and selling for medical purposes only. That as I understood the way it worked. So there is farmers going out of cow business, but they might go into raising the hemp, and it will be legal to do that. But it's the soil that tells them if they can raise it or not.
Yeah.
We learned that a year ago down at NISAC.
Morris?
Yeah, I just want to make a report. I've been down to see Mr. Proud. He's coming. He's still working for his bottle of wine. I told him when he stood up, we'd get him a bottle of wine.
Oh,
And he's standing up and being able to balance himself a
good.
little better. Also, Barbara Brown got into an accident, and she's down there. She got banged up pretty good. She's at the Seneca Hill on the second floor, and so she's coming along. She probably will be out in a week,
Good.
but she got banged up a little bit, broke her wrist and a few other things. Rolled the other car over. Solos the other car over.
Oh, wow.
She did a good job.
But the way she said it, she said, when she called me, and she said, I hit her and rolled her right over the soybeans.
And she did.
But that's hard.
Okay, just thought I'd mention.
Okay, so,
I just have a real quick question about the rabies.
Yeah.
When you travel to foreign countries that have, like, rabies is a prevalent issue, you have to get a vaccine. We had to do it to go to India. Do you ever see
that happening here where we do it as a preventative vaccine as opposed to doing the prophylactic?
Prophylactic only for these professions, they handle animals. This, yes, CDC recommended. And like vet, like
Yeah.
animal
Do you
handler.
see it becoming, because I mean, it feels like the rabies incidences are, I mean, I know they've stabilized a little bit, but it just feels like we are in an environment with a
Yeah.
lot of it around us. Do you ever see the recommendation changing to citizens having to get that
No,
vaccine?
not
Not in the near future.
not to this, yes. Because like India, Thailand, and yeah, in the whole world, every year about 30,000 cases in the world, but mostly in developing countries, especially Southeast Asia countries, yes.
So I need a motion for budget relief.
Make it.
Second?
What are your? Oh, thank you. Oh, thank you much. Appreciate that.
Gotta make a correction, let's redo that. We need a motion to accept the budget.
Hmm?
This is for discussion.
I'll make the motion again.
Okay, second, okay. Now it's up for discussion.
While we're-
Right?
I'll let Margaret go.
Oh,
He's on a
no,
roll
I
today.
just wanna say while we're
He's liable
waiting,
to, do some more doo-doo and rolling in the floor and everything.
well, while we're waiting, Milford had, his wife had doctor's appointments this morning, so, and changing the date of the meeting to Wednesday here interfered with what, obviously he's not here, and he just wanted to let people know that he had to take his wife to the doctor. So,
Do you wanna start out?
Yeah,
And then I think Frank has some questions.
No question, just a comment.
Just a copy.
I have a few proposed changes here.
No. Not gonna be. Not gonna be.
So while he's passing that out. While he's passing that out, it's my other life I live in, I have to make this comment because it just, we cannot be discussing other people's health issues in this community. That's a HIPAA violation.
But I voted for it.
thank you, sir.
You voted for the HIPAA violation?
No, for her to say it.
Yeah, I just want to remind the committee that health information is protected unless the person who's involved in the issue wants to release that.
So in other words, I shouldn't be making a report.
That's what it means.
I'm sorry.
Nobody should. Okay? Thank you. Okay. You want to go through changes, or do you want to do your question first?
No, I don't have a question, it'll be a comment when we get ready.
Comment? Okay. Nelson, you're up.
Okay, so the changes to most of the social security lines are just based on recalculation after the vacation buyback was pulled out of our budget. In 4010, I'm asking that the budget amount be put back up to what we requested, as various positions in that admin, including the accountants, the DPS, the GUPFIN, many additional hours that to save budgetary stress, we actually use comp time, but I don't want to be forced to do that, or force other people to do that. So I'm asking that be put back up to 2,000. In 4035 preventive, that's just a social security change due to the vacation buyback being removed. In 4090 environmental, we have a current typist who is retiring in December. So I'm proposing to reduce that particular position number, which is listed in here, back to a starting rate. And currently in environmental, they have 2 youth aides that they use to perform compliance checks on tobacco and vaping supply sales. Because of the fickleness of teenage kids, two is not always enough. You'd have things going on, other things with school or after school. So they would like to add a third position, but in reviewing the amount of time that they actually use the kids, they feel they can actually reduce each position to $1,800 annual. Right now, there's two in the budget at $3,300 each. So that's $6,600 total. We're asking to reduce that total to $5,400, divided amongst 3 youth aides. So that saves us $3,308 total between the reduction of the rate for the typist plus the reduction in the total youth aid cost. Saves $3,308. Because you previously passed the resolution to allow us to buy the XRF 2019 funds, we can reduce the other equipment line by $17,000. But in doing that, we have claimed reimbursement on that $17,000 piece of equipment. So that's why there's a reduction in the state aid public health line above 14.9. So the net local share savings of this as a group is 7,204.
Mr. Chairman, great question. Vacation buyback was moved from your budget to a central vacation buyback account,
Okay.
but all the social security lines remain the same because what happens is I do a journal entry every month, charging that back to your budget.
Okay.
So which one of these is a change related to vacation buyback? We'll have to take them on.
All of them.
All of them on?
Well, the 4090 would also include a change in the salaries. So that's not all vacation buyback. 4035 would be all vacation buyback. 2980 would be vacation buyback. And 4189 would be vacation buyback. Those are total.
Okay.
So those 3 plus a portion of the 4090,
Plus a portion of the 4090.
so we don't know. how much that is.
And a portion of the 4010.
No, 4090 would be 11,084 times.
You're still gonna end up saving money.
Yes.
Don't worry.
Yeah.
Not so
Yeah.
much. All right.
847.
So where's the social security budgeted for?
It's not, it's
So
still
then-
in the department
Okay.
budgets. So his vacation buyback is charged to the central account.
So the line goes to central account.
FICA comes out of that, FICA goes there as a negative, and then I transfer it back to, yeah. So you said, 4090, that's one of them that has a part of it in there?
Right,
What's the other 4010?
4010, right, because I was bumped it up for the additional 400.
It's just a curiosity on your youth program, youth aids.
Mhm.
What, there's teenagers, right?
Yes, ma'am.
So what did they do when they have a chance to work?
Well, now, I believe, again, not very amount, but the way the system works now is they have to coordinate, I believe, with state troopers, and one or two of those will go out with the state trooper and a health department employee. They go to various shops and would attempt to purchase tobacco or vaping supplies.
Oh, I see. Oh, all right. Okay.
Make sure that they're not selling.
Thank you.
Mhm.
How long have you been using them? A couple of years or?
Oh, many, many years.
The
but
program,
usually-
the program.
Oh, it's, since I've been with the health department, so it's over 20 years ago.
Oh, I see. Okay.
Do you get paid hourly though? I'm
Yes,
sure they don't
yeah.
get the lump
They get-
sum if you're not.
No, you get paid a minimum wage hourly. Yes.
So you give me a quarter. You want me to call the town hall for
That's interesting.
All right, so that changes your number from 7,204
Mhm.
to 5,145.
No, it doesn't-
And I'm gonna leave social security and vacation buyback in your budget.
Okay.
To the chairman.
Yeah, Madam, this is just, I redid this entire form.
Okay.
I have to submit this with the budget, so I redid the entire form to add this.
Add those in.
This is already in the original budget. There's a
These are
people
budgeted.
in the mosquito program.
And then,
There's no change to that. I have to redid the whole form.
oh, okay.
Spreadsheet needs to be amended to
Thank you, sir.
$5,145. As the total reduction based on this format.
Looks like you're removing A 2980,
There's new handouts.
A 4035, part of it's A 4189, and adjusting the figures for,
4010, $392.
okay,
And 4090, $847.
okay.
And that all- That should be enough.
Has everybody got the new figure?
Yeah. When you're done with that, I have a different question.
Yeah, well, we're gonna do an amendment and get that fixed, and then we'll go on. So I need a motion for an amendment to adjust it from 7204 to 5145.
I'll move it.
Second? Second. Any discussion? All in favor?
Aye.
Opposed? Okay. Shane?
I guess in the packet, I printed out before coming, I was looking at the attachment A's and additional positions. I mean, I'm not sure if we didn't get to it, or, I mean, position requested for new positions, is that in today's packet as well? Today's health packet?
Well, the youth aid position.
Okay.
I mean, I just printed this out, there's the amendment A, and then there's attachment A for justification for the need for lead program.
Yes. This, today's package Nelson just distributed is for youth tobacco program only. And what you talk about the lead, we requested the two positions is lead program related. Because,
It
yes,
says new position.
increase the volume, yes. Yeah. It's already in the budget. It's already in the budget package. And,
Yeah, we're not, that was just a form, we're not approving any positions, we're just approving, they've already got that in the budget. Right. If it doesn't get approved,
But it's not in addition to this? but
Well,
it's
the-
2020?
The third youth aid position would be an addition.
okay.
Right now in the budget is two youth aid positions at $3,300 each. We're requesting to add a third one, but reduce them to $1,800 each.
Okay.
Shane, legislative road, I think you're referring to the early intervention specialist that says, new position request.
Yeah,
That's budget backup, it doesn't require separate action by this committee. That position's in the draft budget, so if you approve the draft budget today, it's approved with that position in it, unless the committee takes it out.
well, why isn't it just saying on here?
Yeah,
Oh,
that's
it's
what we're wondering
changed.
why they changed.
It's
and
changed.
requested.
Because those are changes that they're
Since-
requesting after the draft budget came out. After this budget. So that's an amendment to the draft budget.
Oh.
So there's a world of other changes probably that are outside of this maybe, that if we haven't had time to really dig deep, that.
So, but what about the youth? The addition of that?
You just approved that.
With the amendment.
Right.
So would it be possible to go through quickly and just say what are the big changes in the budget itself?
Yeah, we can do that. Do we want
I
to do
think
this?
that's probably the change
Yeah.
you are.
Well, the director can,
Why don't
Yeah.
you cover this?
Sorry, I just distributed, a request, and this request, yes, it's, when I work with, director of, HR, go back early September, and, but somehow not, yes, included here, I'm sorry, and, push you here at the last minute. And the request is really slightly adjusted, the DPS salary. And the DPS, salary compared to the same, G50 level and, she's low and look at two people's their background and when I compare with environmental health department director and director of patient services and one 18 years service for the county, the other 12 years service to the county. And one has a national certificate, the other with a master degree in nursing. And so this, I work with HR director and we feel yes. Just a little bit and after reach 18 years and they will compensate very similarly. So I calculated that it's $700 differences and ask you, yes, consider. Before the meeting, we were joking at another room and here $7,000 savings and ask you to get your permission, reinvest the $700 to this salary adjustment. That's my request.
Okay, so
That would be amendment number.
where did
An
the,
amendment to the budget.
so what does the actual cost be if it's, because they can't be reimbursed, she can't be reimbursed under part of that.
No, yeah, she, her 50 of her salary is stated reimbursable, right?
I believe so, off
Yeah.
the top of my head.
50%.
So out of that increase, half of that would be reimbursable. So what the actual figure would be,
So,
I don't have the number.
yeah, in the budget, her salary is 7949. Okay, yeah, and so the cost here is $717, and if 50% is $360.
So he budgeted, this is the amount that has to go up, but he already budgeted, an increase from the 68 to the 70. And so the difference is only $700,
of which half of that is
717.
reimbursable.
half of it's reimbursable. So we would be, taking it from the $5,000 that we're saving already. So you need a motion for that, or how does that go
Yeah,
down?
it has to be an amendment.
I'd like to make the motion for that amendment.
Okay, I have a second.
I'll second.
Second. All in favor?
Aye.
Opposed? Thank you, Frank. You
Thank
made my
very
day,
much.
buddy.
Thank you.
Okay,
But we have to now go and amend this number that we just amended?
No, that's not part.
Okay, but we
Wasn't
need a,
part of that first
so we
amendment.
didn't have,
It's
it's
a
not part of
separate
it.
it's
action.
a separate,
Okay.
okay. So now back to the question you had, which was, and you had about major changes. If you would like to ask those questions.
I don't think I should have to ask questions. I'd just like somebody to just give me the summary, talk about a summary of projected changes, big or
Okay,
small.
Okay.
So I'll go through what I see as the major changes to this year's budget. Starting off in 4010, we have an account clerk reclass to a senior account clerk.
It starts.
We have in 4035, preventive health.
So, hold on,
Yes.
the computer specialist, you said went to IT?
That's a position that was in IT that was moved to his budget in 19 because they needed it to be in his budget for aid purposes. But then they determined that it didn't need to be in your budget anymore.
Well, it's only, we can only get reimbursement for the time spent at health department working on Article 6 tasks, and found that to be a very small amount.
Right. So it wasn't
So-
worth,
Wasn't worth all the paperwork and all the
I'm just saying, the
tracking to,
the 4245 went somewhere else.
it's in IT.
yes, an IT,
Okay,
yeah,
that's all,
some
that's
services,
what I-
yep.
Nelson, as you go through this, I think it'd be helpful to read the page number you're referring to.
Oh, I'm sorry, yep, sure, of course. Okay, so that was on page 82. On page 84, Preventative Health, Department 4035. There are two positions, one account clerk and one supervising public health nurse. Previously this year, that account clerk position was changed to a health program specialist, and those two positions are working pretty much exclusively on the Healthy Families program. So we created a Healthy Families department with their own budget. That's on page 87, so that's Department 4036. So those two positions got moved to 4036. So I reduced it out of 4035, moved it. And also in 4035, on page 84, position 4035, 20301, that senior account clerk was a reclass of the account clerk that's farther down the list. And those positions are, get reimbursement from Article 6 state aid. The next major change in this year's budget, you would find in Department 4059, which starts on page 88. The change itself is on page 89. Because of over the past year, 2 years, it's been like a 27% increase in the number of early intervention referrals. We're requesting to add another early intervention specialist to meet with these kids. They are just overloaded right now with what they're doing because the caseload has jumped so much. So they added an early intervention specialist on page 89. And then page 91 in environmental, they're requesting to add a public health technician, which is on there is 4090-01102. And then also in 4090 would have been the changes that we had discussed earlier, reducing one of the typists to a starting rate, and the youth aides adding a third and reducing each line.
The public health technicians related to the lead mandate, correct?
Yes, yes. Because they expect those cases could increase actually tenfold based on the new regulations from the state.
Nelson, you have looks like three new positions in 4090.
Right.
One is, one's a sanitarian and two are technicians. Last three is 905, 101, 102.
Yes, one position is already created by the committee at the
Couple months ago.
yeah, couple months ago.
Yes, I'm sorry. So yeah, there's also
So-
the public health sanitarian and a technician.
Yeah.
Right. Yes.
So sorry.
Go ahead.
So the technician, the 1102 was the one we moved a couple months ago. That's why it's not in the 2020 request, because it's already in. 32114.
Right. Yeah. The other two are the two new ones. I'm sorry,
Right, so
yes.
the ones in the 2020 request are what we have for new positions, correct?
Yes.
And this is the information for the justification of those positions.
Yes. And of course, another equipment, we reduced that from 18,500 to 17,000 on your previous action today.
So
I'm sorry.
I guess I would ask, Commissioner, do you want to Is this what we have right now? We're supposed to read this and say, okay, here's the justification for 2 new positions in the budget.
No, three new,
Right, I guess.
So,
two, two position in health, environment health, and the other at early intervention.
Maybe some of the two in environmental health, the public health sanitarian and
I
public health
wonder if you could
technician.
take some time and just tell us the story of why we need these positions, if I missed that so far.
Okay.
I mean, because we just did this 2 months ago, right? We hired a,
2 months ago, we hired a technician, is not, lead related.
right?
And, at that time, I said, I forgot to give you the time, and our public health engineer, he's overworked and needs help. And that's why we give the lowest possible staff and help him out a bit. And here, 2 new position here added is because lead program, and the lead program, we expect the case will increase 10 folders. And the volume, case volume, I can give you specific. 2018, we have 4 cases above 15. And the state average past 3 years, and our county, they estimated, and we will have 42 cases if we lower the standard from 15 to 5. This originally, our department calculated and deal with this situation, we may need to add 4.5 to 5 full-time staff, include a nurse. Internally, we struggled, and we worked with our managers and decided, yes, we request only 2 because we understood the county's financial situation. And also, I can share with you, and yes, NICETRO is collecting survey data, ask each county how many staff you added for lead purposes. I didn't fill the survey. The reason I feel, yes, we need 4.5 to 5 staff. Actually, we add only 2. I reported, and this we victimize ourselves. I'd rather the county, the average, say, oh yes, each county add whatsoever. Definitely more than 2 people, and I hope we can get more state reimbursement at that time. That's why I didn't reply the survey. And if I reply honestly, say we add only 2 people, this is understatement. So what I try to say is, look at the 2 people. Yes, I know it's a burden for the county, but as a department, we already did our best to reduce county's burden. Put it this way.
So I understand, and we typically will say, okay, 2 positions plus fringe is gonna be approximately $115,000 added for 2 positions.
Yeah.
Where is the revenue line for the reimbursement for, like, how much, what is the state revenue line projected? Where do I find that?
The revenue,
This,
Specific lead reimbursement. is what
What's
I'm
that?
saying.
yes, put it this way, I can answer. Put it this way. State, when lead program came, state clearly say, don't expect any additional funding. So, but they allow us reimburse as Article 6. If Article 6, all our environmental staff, their 70% salary is reimbursable.
So,
But this is
93 shares.
not include benefits, no benefits, right?
Correct.
No benefits, but the salary 70%. So these 2 positions, yes, 70% reimbursable.
okay,
Halfway down the page,
just state
so
aid,
state aid, public health,
so it's in there,
it's in there.
it's a blended.
Yeah.
Yep.
That's how it all comes back.
Yes,
That's gotta be fun.
it's a fall.
I'm sorry, one other question about,
Yeah.
so specifically regarding that, you're talking about the reimbursements. So they're projecting you need 4.5 people. You're adding 2. I mean, are you setting yourself short right now when we should be projecting an entire year of revenues? Or are you gonna be back halfway through the year saying I need 2 more people? And then it's gotta be pulled out of, what, fund balance or whatever to make the positions happen.
I do not expect that we will come back in the middle of the year. But I cannot say we will not come back like early intervention situation. We do our best to defend the county's benefits. And really, if it will not work out, we may come back next year. But we have no plan in the middle of the year we come back.
Yeah, and that was part of the conversation at NISAC, was that there's no barometer to predict whether it's gonna be 5-fold, 10-fold. We don't know that. I mean, we know what we're doing, and by dropping it, the assumption is it's gonna jump 10-fold, but that may or may not happen.
Yeah.
It's gonna go up.
The other is it takes time to go up because it will not immediately go up. We need a lot of work we need to do is, yes, work with physicians, ask them testing kids.
Right, so it's gonna be based off like Margaret's question, how are they gonna come to my house? It's based off the physician with the blood test that
Yeah.
says this kid's
Yeah.
rate is over this
Yeah.
amount. Now we're going to the house and we're doing those things.
Yeah.
So that's what these people are going to be participating in.
Yeah.
Got it.
And there's a follow-up, and a follow-up, and a follow-up.
But when does that begin? What's
Start
the
October
timeline on
1st.
it? First?
Start October 1st, I believe, the new
Right, so you
regulations.
said then, this could start right away and your team was gonna manage it.
Yeah,
But
Till
it's gonna
first of the
take
year.
time to
it
see.
takes time.
Yeah.
I think I got 'em.
I imagine, I imagine though, it is a problem that once you get it kind of under control, right? The need for these things will start to diminish over time. I'm thinking like,
Over the time, long term,
10 years down
yes,
the
yeah.
road, we won't be needing a lead specialist because hopefully we've conquered that issue.
Yeah,
Because it really is an issue based, kind
Yeah.
of steeped in our past, of not knowing.
Got more?
That is all the major changes.
Any other questions, comments, Frank?
This, I already sent out everybody my comments on the budget. And I can't show favoritism and say yes to one person's budget that's doing something that I have requested that everybody remove. So I just want the health department to know that, as long as there are raises in the budget for department heads that are not union contract negotiated, that I will not be voting in favor of that budget. Not because I don't think they deserve them, but if there's any savings that can be documented from these, not doing these, we should be passing these savings on to the taxpayer in the form of a tax reduction, not a tax of status quo. And for those reasons alone, I will not be voting in favor of any of the budgets that have any raises in there. I'm sorry. Thank you for your job. I'm not saying you guys don't do a good job. If there are budgets that I could say yes to, then it'd be look, I was paid, you want to show favoritism to somebody. I have to go right straight across the board. I'm not, I can't do that. That's not me. Thank you.
Following up on Frank's comment, and again, I'm not making an opinion, I just want to point this out, on page 96. Your net county cost in 2019 adopted was $4,663,353. And the 2020 draft is $4,593,312, and we just added about 5,000.
Took 5,000
Right.
less.
5,000
less.
less.
Added
So
700.
And then brought back. Yeah, that's it.
But it's really 350, so.
Plus minus, got it. So not, you each have to make up your own mind. I just wanted to point that out, that
But Jim, what I'm saying is, that savings is there with the raises in there, okay? Then if you took the raises out, it would be that much more of a savings and that much more could be, passed on to the taxpayers. That's all I'm
I'm
saying.
not being judgmental on
Okay, I'm just saying.
that. I just wanted to make sure.
Well, I just
people
wanted,
saw it.
I see it. And I know that everybody's budgets are, great budgets. That Phil and Steve did a great job with the budget. It looks, everything looks good. But I'm sorry, when you're looking at that and you're looking at what you're doing with the savings, okay? It doesn't come out, where I can say yes to it. I don't care who it is, okay?
Well, there was many years where, and there was somewhat of a contract in place, even though it's not a union type contract with management. And the legislature pulled that out from underneath the management a couple of years into the program, basically leaving them in the grades for many years at zeros with no increase at all. While the legislature sat here saying, go cut, go find me more, go find me more. Those are the people we're tasking to go find more cut, which gets those numbers down. So necessarily, I was happy to say that we kind of got it back, the management contract on the table, even if it's not a union negotiated type of a contract, that those are the people that we're tasking to go do the cuts and work directly with the legislature. Therefore, I would stand behind the agreement we have in place because they're the people on the front lines for us. So that's just my take on, the department head increases that are agreed upon.
Any other comments? I think we're ready for a vote. So, health department budget, those in favor say aye.
So
As modified,
Question.
amended. Yeah, go ahead.
so these changes, we'll just get, folded into the act. Do we need to do anything with this draft, or we're just voting on this?
Voting
We already
on the
amended,
drafts.
So we're passing along basically.
Steve passes his
F&P.
amendments on the F&P tomorrow. His final say as to whether they actually get into the tentative budget.
Okay.
Okay. All in favor say aye.
Aye.
Opposed? Thank you.
Can we ask, because there's other positions that HR might be able to do? It would be easier coming into today a little bit. We get these at the beginning of the year and changes take place throughout the year. It'd be a lot easier, if we sat here a little bit and had this one pager, HR department say, okay, well, this is the department, you know what I mean? We're adding a couple new positions. It just makes life, we're
Summary.
very simple people, right? Colors and big blocks and stuff.
All of us.
Okay, so we have an executive session, short one.
Motion is second.
Need a motion
I'll
to
do
go
an
into
executive session.
a second. Second, all in favor say aye.
Aye.
For the record, it's for regarding proposed pending or current